As seen from this example, nurses and social workers have roles on healthcare teams that are both unique and overlapping in their competencies and tasks. They must communicate in order to work together in service of patient care. This process of multiple health workers from different professional backgrounds working together with patients, families, and communities to deliver the highest quality of care is called interprofessional collaboration. In many places, the terms interprofessional and interdisciplinary are used interchangeably, while the term multidisciplinary is used quite differently. In contrast to the collaborative team commitment implicit in interprofessional or interdisciplinary care, multidisciplinary implies many team members who are all caring for a patient individually, but not necessarily working together to do so. It's helpful to take a step back and think about evidence in support of high-functioning healthcare teams and how they might best be actualized. A national and global call to action has shed light on the value of interprofessional collaboration. The Institute of Medicine, or IOM, has called for transformation of the healthcare system to provide collaborative, high-quality, and cost-effective care for patients. In 2001, the IOM stated that equipping the workforce for the future entails developing new ways of relating to patients and each other. With this mandate, we are presented with the opportunity to discover effective ways to train or retrain our current workforce in effective interprofessional behaviors and the knowledge, skills, and attitudes to incorporate these into daily practice. The benefit of effective interprofessional collaboration has been documented in research, with evidence of better patient outcomes and higher patient, community, and healthcare worker satisfaction. Interprofessional collaboration has been linked to a range of outcomes, including patient safety and the provision of better health services. A report sponsored by the Interprofessional Education Collaborative, or IPEC, identifies the goal of interprofessional learning as preparing healthcare team members to work in collaboration towards the common goal of building a safer and better patient-centered and community population-oriented U.S. healthcare system. Interprofessional learning is based on the value of learning together, as it provides a shared experience for healthcare providers to exchange ideas and gain insight from other perspectives towards that common goal of improved care. IPEC has developed specific individual-level core competencies that healthcare providers should be proficient in order to work successfully on teams. 38 subcompetencies are all describe the essential behaviors and are grouped into 4 competency domains. These domains are values and ethics for interprofessional practice, roles and responsibilities, interprofessional communication, and teams and teamwork. The IPEC report describes the competencies in detail that are the underpinning of the key processes of communication, cooperation, coordination, and collaboration and teamwork named by the IOM report, and relate these competencies to the delivery of patient and family-centered care. Part of interprofessional education is that multiple disciplines come together in an attempt to strengthen the healthcare team. Breaking down the silos is a common sentiment in respect to the goal of interprofessional education and collaborative care in our attempt to foster learning environments that encourage enhanced collaboration and understanding of other perspectives. Professionals respect the value and insights gained from other disciplines and from the patient. Topics for learning might include team function, effective communication, collaborative leadership, group goal setting, conflict resolution, and the patient perspective. Returning to Mary's specific case, how might a well-educated and committed professional team best provide her with care? Please take a minute to refamiliarize yourself with this case. If truly functioning as an interprofessional team, professionals will develop shared goals. What might some of these goals be for Mary? One of these goals might be to treat depression. This goal might include different tasks spearheaded by different professionals. For example, the primary care physician or advanced practice nurse might write a prescription for an antidepressant. The nurse in the office might educate Mary about medication adherence and provide ongoing medication monitoring. The social worker might meet with Mary for weekly individual therapy, using the evidence-based practice of cognitive behavioral therapy. You can see on this slide various other shared goals that an interprofessional team might develop for Mary. These might include supporting Mary in obtaining stable, accessible housing, improving Mary's access to affordable, nutritious meals, stabilizing Mary's diabetes, and maintaining physical wellness, and reducing social isolation. Now it's your turn. Choose one of these goals. What tasks might physicians, nurses, and social workers perform on the team in order to help Mary obtain this goal? I'll give you a minute to think about this before we move on. In order for teams to effectively work together to develop and implement shared goals, they must work in integrated care settings. SAMHSA defines integrated care as the systematic coordination of general and behavioral health care. In order to clearly define terms, behavioral health care, which in our case example is provided by the social worker, but can be provided by a range of mental health professionals, is defined as the prevention, intervention, and recovery from mental health and substance abuse. It also encompasses promotion of overall wellness and health. There are various models of integrated care settings. Most familiar are models that integrate behavioral health into primary care. However, there are also models that integrate primary care into traditional behavioral or mental health settings. As you can see in this table, HRSA has developed a system for categorizing levels of integration, regardless of specific care setting model. You can see levels 1 and 2 involve minimal collaboration of healthcare providers who are not co-located. There's often communication between providers, but limited coordination of care. At levels 3 and 4, teams of providers are in physical proximity, communicate regularly, and collaborate on patient care. However, the teams are not fully integrated in terms of office space, nor in terms of shared treatment goals. Levels 5 and 6 involve full integration of teams in the same physical location. These settings have high-functioning interprofessional teams who understand one another's professional disciplines and roles, communicate, and work together on shared goals for their patients. One care setting that is fully integrated is the PACE program. PACE stands for Programs of All-Inclusive Care for the Elderly. PACE is a national model that is funded through Medicare and Medicaid to provide necessary holistic care to keep elders at home in the community instead of in a nursing home setting. PACE has been in operation for over 40 years, and studies have shown positive outcomes for participants. PACE programs have expansive interprofessional teams, as C.G. Swift, a social worker at Pace Mercy Life in Western Massachusetts, will further explain in this video clip. This video will be shown in the next section of this training.